What's up, everybody? Welcome to the Good Wolf Project. I'm your host, Jerry Scarlato, and today's conversation is with Dr. David Bilstrom. David is an autoimmune specialist who practices holistic health, which means that he's not the kind of guy who's just going to hand you a pill and tell you to be on your way. What he wants to do, and what we talk about in this episode, is how you can get to the bottom of things so that you can start to understand what's happening with your body instead of the lie that this is what you have to do and you have to take this medication for the rest of your life. And that's just the way that it is, which is a lie. If you start to understand what's happening with your body and you start to unplug things and you start to figure things out, then you can start to make some significant changes, both in your physical health, your biological health, your metabolic health, and your mental health. Yes, your brain is impacted by your gut and what you're eating, which we talk about in this episode as well. So make sure that you get your notepad out, be ready to take some notes. Also, if you have not done so, make sure that you, what am I trying to say? Make sure you go review this podcast, go review Good Wolf Project. You can pause it real quick. It's not going to hurt my feelings if you walk away and go give us a quick, you can give us up to a 5-star review. That helps us spread the message. The more reviews we have, the more people we reach. So thank you so much for doing that. Now, enjoy this episode with Dr. David Bilstrom. David, good to see you today. We already did a little pre getting to know each other, but I admittedly am selfish about this interview to a degree because what I want to get into is a little bit about the difference between intolerances and allergies or allergic reactions, I guess, when it pertains to food, especially. And the reason that I'm selfish about this to a degree, but I also believe that this impacts a lot more people than we know, because intolerances are harder to grasp onto because they can come 24, 48, 72 hours after you eat food, and then they can also accumulate. So they're harder to gauge. I probably have histamine intolerance. It hasn't been diagnosed through testing, but I did an elimination diet a while back and slowly added high histamine foods and recognized that that's probably what I have going on. I'll get flakiness in my skin, I'll get headaches, I'll get tension in my neck, I'll get anxiety, I'll get all these things if my histamine levels get too high. And it's based on an intolerance to certain kinds of foods which have high histamine or release histamine in the body. And like I said, I believe that there's a number of people that potentially have something going on. Maybe it's anxiety, maybe it's some sort of mental fog, and they think that it's based on, I don't know, some external thing that's not food. So I want to start with the difference between intolerances and allergic reactions or allergies to food before we actually dig into how it can impact you in a different way.
Yeah, so I think you touched on a really important point where if you have excessive inflammation, it's going to show up as so many different things. Now, in your case, you've kind of identified that histamine, which tends to create inflammation, is excessive in you for a particular reason, but that excessive inflammation, all these different things. So the question always is in somebody when they have these health issues, isn't whether you have inflammation or not, you have excessive inflammation. It's just how it works, but it can show up as 1,000 different things, and potentially could show up as 1,000 different things all at the same time. Right? Like you're like, well, I got this, this, and this. It's like, well, everything's connected, right? You can have joint pain, muscle pain, brain fog, fatigue, insomnia, gut issues, skin issues, allergies, and you're like, oh my gosh, how can everything get whacked at the same time? Well, everything's connected. Something's creating excessive inflammation. We just got to go back and do our due diligence to figure out what that driver of excessive inflammation is, or combination of things. And so histamines create inflammation. Now, kind of the larger picture there is histamine and mast cell issues. So mast cells will release pro-inflammatory cytokines, creating all this inflammation. Now, ideally, if you have a real healthy gut, you don't have histamine and mast cell stabilization issues. So you say, okay, what's going on with the gut? Well, truly, the gut is the central mechanism in everything anyway, right? So if you got skin issues, 90% of the time, I'm thinking, what's going on with the gut right away? Brain and gut connection, a lot of people hear about. So if anybody's got enough brain stuff to get in the way stuff, I'm thinking, what's going on with the gut? Now, as a specialist in reversing and preventing all autoimmune disease, where the immune system actually attacks our own body parts, or the other part of the immune system is damaged and it allows this excess inflammation, 80% of the immune system surrounds the gut. So if you got excessive inflammation for any reason, immune system, mast cell, histamine, really the first thing you should think about is the gut. But that was what your question started with when you asked about food sensitivities, is you're really asking, so what happens to the gut that then drives food sensitivities or food allergies? And so the gut is separated from the bloodstream by the wall of the intestine. And there's things that get into our intestine, like food products, like vitamins and minerals and proteins and good fats and all this stuff that need to get from the intestinal lining, I'm sorry, the intestine into the bloodstream and go all over our body up to our brain. And here are these nutrients that our body parts need to make things and fix things and be happy and healthy. So we have these things called tight junctions in the intestinal wall. And they're called tight junctions because they are tight. They are not going to let things in from the intestine to the bloodstream that shouldn't get in, right? But these tight junctions can get damaged and then they get leaky. So this is where you've heard for many years the term leaky gut. Well, medicine is really interesting. Basically, medicine likes to poo-poo anything that's new until it's been around like 1,000 years, and they go, "Oh, okay, yeah, okay. Everybody else kind of knew this before us, but we'll change the name because that's not very scientific." Leaky gut. Well, the name it got changed to is intestinal permeability disorder.
Sounds fancy.
What's leaky gut?
Sounds
right. It's just like, well, yeah, it's the same thing, different. It's different wording. And so things like stress can do it. Classics are antibiotics. Classics are like Motrins and Advils and aspirin. All the NSAIDs create this. A fair amount of medications will do this, create the leaky gut. Acid blocking medicines, and everybody's on medicines to block stomach acid. That'll do it. All kinds of different things will do this. And what then happens is that there are things that are in our intestine that really should be pooped in the toilet or stay in our intestine that actually can leak past the leaky gut, the leaky intestinal wall, into the surrounding tissue. Now, the first thing it encounters is the immune system. 80% of the immune system surrounds the gut. And so when we eat foods, we're supposed to digest them. Now, it's a multi-step process. Saliva chemically starts breaking food down. Teeth mechanically start breaking food down. Gets to our stomach. We have hydrochloric acid, super low pH, super acidic. We talk about more acidic than battery acid. Digests the food more. And then it gets in a little lower, and here's pancreatic enzymes that digest them. Well, eventually it gets down into our intestine. In a totally broken down form, we absorb the nutrients, basically. But anywhere along that pathway, and if you miss one step, the next step can't do its work as well. You end up with undigested food in your intestine, and including undigested food proteins. So these undigested food proteins, well, it'd be nice to get the proteins digested into our system because our body needs this to do its work. Well, they get undigested, they're sitting in their intestine. Okay, I'm going to poop them in the toilet. Well, when you have a leaky gut, though, before they can get in the toilet, they leak across the disrupted tight junction areas into the surrounding tissue. And the immune system goes, oh, okay, here are these proteins. Now, this isn't what I usually expect to see. This is unusual. I don't see this. So I got to decide if this is friend or foe. just like the proteins that might be in the cell wall of a bad bug, bad bacteria, a mold, a virus, or whatever that's got into our intestine. If it gets past the intestinal wall into the surrounding tissue, the immune system goes, okay, you bacteria, virus, mold, candida, are you friend or foe? Well, I'm going to use the proteins on your cell wall to try to determine that. And obviously, if it's an infection, a bad bug that's gotten from our intestine to the surrounding tissue, the immune system makes antibodies, starts attacking it, and kills it. Right? It's like you're not getting past me to get into the bloodstream, the brain, and go all over. I nipped you in the bud. Okay, that's my job. Well, then here are these undigested food proteins. So the immune system is like, oh, that's interesting. You're really not supposed to be here either. Are you friend or foe? And it may say, well, I think you're foe because truly you're not supposed to be here. So you must be somebody, a protein that's trying to hurt us. So I'll start making antibodies against this protein. Food protein. Well, when you got immediate hypersensitivity reactions to food proteins, people can figure this out better than any tests we have. But you can also have immediate hypersensitivity reaction to food sugar. So like a classical is lactose intolerance, which is a cow's milk, as a dairy sugar, but you can get intolerances to proteins as well. So the typical way that people might check for food allergies, so quote unquote, or intolerances is with a skin test or a blood test that you might do locally at the clinic. Super unreliable. It's a great way to test like skin testing for like cat dander and pollen, but it's very unreliable for food sensitivities. So you may get somebody that does a skin test and they're told, oh, you tested sensitive to eggs. Every time you eat eggs, you must feel terrible. And the person's like, no, I don't. Or they are told, oh, well, you're not sensitive to eggs, so you can eat them all you want. And he goes, well, that's weird because every time I eat them, I feel crummy, right? So on the immediate hypersensitivity reactions to foods, people can figure this out better than any test we have. It just happens every time. So extreme example might be kids with peanut allergies.
Mm-hmm.
You know, every time they eat a peanut, throat closes up, they got to go to the emergency room. So it's not going to take a rocket scientist to figure out, hey, dude, don't do that again. That about killed you. You probably should not do that again, right? Now, maybe more subtle is somebody that goes, geez, every time I eat ice cream, I get really gassy and bloated. And, you know, so you know there's got to be something in there, right? But so high histamine foods can do it too, right? Geez, I eat high histamine, I feel poorly. Okay, you figured that out yourself. That's cool. Now with the high histamine foods, ideally, your body should be so good at controlling inflammation that the bit of inflammation that the high histamine foods might create, your body goes, no problem, no worries, I'm totally good with it. But if you have kind of some overriding, some inflammation sort of sitting there already, that your body's having a hard time getting rid of, and you add some high histamine on top of it, foods, it might be too much and you feel kind of a thing. So then you go back to what's creating a little bit of this chronic smoldering inflammation, that when I add a little bit of high histamine foods that give some inflammation to everybody, I actually feel it, but maybe other people don't. But then you got these delayed hypersensitivity reactions of foods. And this is the one that you referenced where it's only the food proteins that do this. So you eat a food protein and days later, or even up to a month later,
wow,
the proteins keep circulating in your system
mm-hmm.
long after we eat them. And then it whacks you and creates inflammation. Well, if it doesn't bother you right away, the immediate way, you keep eating it, thinking you're fine, but that inflammation just builds over time until somebody may say, geez, this is kind of interesting. Where's all this inflammation coming from? You know, I know it's got to be coming from something, right? Oh, but what I know for sure, it's not coming from what I eat, because nothing that I eat makes me feel sick. Well, it doesn't make you feel sick in the obvious way. It's the sneaky way, the delayed way. And so potentially you've identified high histamine foods is bothering you. Well, you might have some chronic smoldering inflammation that you just build it on and now you feel it. Well, potentially there could be a delayed food sensitivity to some other food protein that has created that little bit of chronic smoldering stuff. that you just haven't figured out yet. So these immediate hypersensitivity reactions are IgA and IgE immune system reactions. The delayed are IgG. And so if you really want to get an interesting conversation going with a lot of more traditional medical doctors, you talk about this IgG thing. And you may hear like, oh, no, that's not a thing, right? Well, the science is very clear that it is a thing, including irritable bowel syndrome, IBS. Worldwide problem, 15% of the world population has IBS, which you eat something and all of a sudden you dump poop, a lot of times liquid poop, quick, bloating, gas, food, notoriously hard to treat. Well, it's almost 10 years ago now, this couple of great studies came out that if you have IBS and you eat clean based on testing for delayed hypersensitivity reaction foods, the foods that bug you sneaky, and you avoid them, you're 40% better after 4 weeks, 80% better after 8 weeks. And you go, well, this is notoriously hard to treat. IBS is not actually hard to treat after all. It's just delayed hypersensitivity reactions that you've developed to foods. And so, super common, super driver of stuff. We got such messed up guts in our world. If it's not gut symptoms, but just about everybody has some gut symptoms, the gut's such a central mechanism, you may not even have gut symptoms, but showing up as everything else in your body. So the first thing you should think about is the gut. So a food allergy would be more of an immediate hypersensitivity reaction. I eat it, I feel crying. Now, it could be profound, like a peanut allergy, right? Or it could be more subtle. The delayed ones are very sneaky delayed. They build over time. And this is where you go, okay, so I got inflammation that I'm not sure where it's coming from. I'm thinking gut. What I would think is a good chance that you have a delayed hypersensitivity reaction to some food proteins, even if you don't have any foods bugging you in the obvious way. Now, when it comes to autoimmune disease, whether you're talking about all the traditional ones like rheumatoid arthritis, psoriasis, ulcerative colitis, Crohn's disease, multiple sclerosis, lupus, all this, but even autism, with 70% of all autism is one particular autoimmune disease that attacks the brain. You always know somebody's got a delayed hypersensitivity reaction to the proteins in wheat. There's 62 different kinds, gluten's one, and cow's milk dairy proteins. Butter's okay because it's 99.99% fat, and it's actually an incredibly great fat for the gut. But you always know they got this. Now, they could have other ones. If you have enough brain stuff, that brain stuff is getting in the way of stuff, whatever that brain thing might be, depression, anxiety, memory, concentration, seizures, migraines, whatever, you have a wheat delayed hypersensitivity reaction. If you get recurrent canker sores in your mouth, delayed wheat reaction. If you're an adult with any kind of acne, wheat, delayed hypersensitivity disorder. Teenager with moderate to severe acne, mild acne as a teenager could be a ton of different things, but you got moderate to severe, wheat, and probably cow's milk dairy as well, not universally, but probably. So there's a few things we go, oh, we know that you got this. Okay. Let's get rid of it for a little while. Let's go 6 weeks without that stuff. Try to avoid it best you can. Don't need to be perfect. And then if you say after 6 weeks, this is how fast the body heals and how important the food sensitivities are, not allergies, but sensitivities, delayed hypersensitivity reactions. If you get rid of the ones that are bugging you sneaky, and of course you hold off on the ones that bug you, right away, within 6 weeks, you should go, oh my gosh, you gotta be kidding me. I feel so much better. This is crazy. I've had this for however many decades, years, months. I can't believe it. Wow, this is crazy. I'm already like 70, 80% better overall, or at least 50%. If you can't say that, there's got to be some other ones bugging you sneaky, other than the ones that you figured out because of what your symptoms are. Those couple of things I mentioned. So this is where you can test for this, though. And so this is a little finger prick test called the food sensitivity test. There are ones out there that you can test like 500 different foods. I don't use those. I use one that's 96 different foods. And actually, people can go online and get their own test and test this themselves. They don't even need a doctor saying. The 500 one, when it came out, It was fascinating. To me, way too expensive and way too many things. We don't need that many things. The
Mm-hmm.
body is so smart. We don't necessarily need every test in the book. We just got to get kind of figured out the biggest fish to fry.
Mm-hmm.
But what the 500 one did is white pepper, black pepper. White pepper could be totally killing you. Black pepper, totally cool. And you go, I did. I go, oh my gosh, the body is that smart. It can tell the difference between white pepper and black pepper proteins. That is absolutely fascinating how this goes. Um, but with the 96, that's totally fine. We always talk about the body's so smart. You don't need to be perfect, just perfect enough. Whatever it is you're doing, the body will take a little bit and just run with it. But if you can get rid of these foods that are bugging you sneaky, the food sensitivities, oh my gosh, does that open up the window of opportunity to truly fix everything?
Yeah, I would imagine the 500 test or the 500 food test, most people eat on average, I can only, maybe 20 foods like regularly. That's just a
Mm-hmm.
guess. So, like you said, that 96 test, it only makes sense because I would imagine a lot of people don't even eat 96 different, maybe they do, but not many more than maybe 100 or so different
Yeah.
foods in their lifetime, especially in America. If you don't travel overseas, if you don't do anything like that, like you're eating a very restricted diet, especially if you're eating out of a box, it's very restricted, which
Yeah.
potentially we'll get to. But here's the way I envision it, and this is what's helped me understand histamine intolerance to some degree, is thinking of it as a bucket. So what I hear is in an allergy or a hypersensitivity, when you eat it, the bucket overfills quickly and you can see it very quickly. With a delayed sensitivity, you eat something and the bucket comes up a little bit, and then you eat something again and the bucket creeps up a little more, and then you eat something again and the bucket creeps up a little more, and then eventually it'll overflow. And if it really overflows, you'll have a bunch of things going on, but you could have a few things if it's 3/4 of the way full or halfway full. You might have, like for me, my skin will flake before anything else starts to happen. I'll start to get dry skin back here and over here. And then if it comes up a little more, my eyes will start itching. And then if it comes up a little more, my head, I'll get a little twinge of a headache. And then if it comes up a little, I've noticed this and I've accumulated this over time, so I can recognize these things. But that's kind of the way I envision it. So I'm curious, is it the protein that causes the delay, whether or not it's an immediate reaction thing or if it's a delayed reaction thing? Is it just the protein within the food, or is it based
Well,
kind of on how hyper sensitive you are internally based on your gut microbiome? What's that look like?
well, it's kind of based on just which portion of the immune system is gotten confused. Is it an immediate reaction? Is it a delayed reaction? It just is a little bit of a different part of the immune system. It's just that one kind of does it more obviously, and the other one does it more sneaky, delayed. But one way or the other, if you're eating foods that are creating inflammation every time you eat them, it's just going to build in your system, like you said, and eventually you go, geez, I'm going to get these health issues. And if I keep eating them, it just keeps building. It gets worse. If I avoid them, it kind of comes down. And feeling better, but I can still tell if this food. Now, ideally, if you fix the gut, you fix the leaky gut, you're in a position to fix the food sensitivities. So we usually say, well, if we can get rid of the foods that are bugging you, it opens up this window of opportunity to fix anything, including you fix the gut enough, you can actually fix the food sensitivities. When you bring, when you got a food that bugs you, obviously, the immediate reaction, well, if you're kind of been avoiding it for a while and you're thinking maybe I did some stuff to heal my gut, maybe I don't have that sensitivity anymore. Well, you can try it once and go, hey, it didn't bug me, and potentially you did fix it. Now the delayed ones, being so sneaky, what people will tend to do is, oh, good, they're feeling tons better, and we kind of say, okay, well, eventually you should be able to fix these foods. Well, they feel a ton better. They go, okay, I think maybe I fixed these foods because I was told that I could. So I'm gonna try this food that was bugging me sneaky once. I'll try it once. Hey, it didn't bother me. I think I can eat it all I want now. Well, that's not how it bugged you originally. So what people will do if they haven't reset that food, they'll start eating it now regularly. And then they go, geez, this is really weird. I'm starting to feel, poorly again. I'm starting to backslide again. Geez, I wonder what's going on. Well, they didn't bring it in the right way. And they brought it in when it really truly was bugging them sneaky and it started creating inflammation. So we say when you get rid of these delayed hypersensitivity foods long enough to feel great, we usually say if you're feeling 80% better overall of all the stuff you have going on right now when we first meet, there's a good chance you fix these. We'll start bringing them in. But we got to do it in a very special way called the formal food challenge, where you pick one food a week that you'd identified previously as bugging you sneaky, and you eat it twice a day, 3 days straight. You got to hit the body really hard. But then you stop again and wait the next 4 days and see how the entire week goes. And if the entire week, at the end, you go, hey, I'm good. This was a good week. Nothing felt bad. You fixed it. You can eat all you want. If you don't feel good, and because it's a delayed reaction, it might only be day 5, 6, 7 before you go, oh, well, I don't think that worked. Well, I didn't like that very much. Well, then you write down the date, you write down the food that you're testing with, you write down how you felt crummy. Okay, I'm going to take it out again for 3 months. Then I'll try her again. And in the meantime, I'll try to keep doing the stuff I'm doing for my gut. I'll try her again. Well, you can keep trying it as many times as you want until you go, oh, now I'm fine with this food. I must have healed the gut enough to fix it. I'm good now. But we say, pick, one food a week. So, okay, you've been avoiding eggs, you've been avoiding cow's milk dairy, you've been avoiding actually bananas and pineapples are really common.
Really?
So this week I'll do this, second week I'll do this, bump, 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 bump. And then you're in a position really to reset any of them as long as you can heal the gut.
Yeah, it's interesting. So, and I'm not going to make this about me because I'd like to get to the next part, and that's the gut-brain connection and how intolerances can also impact. And you kind of hit on it a little bit, so I'm glad we can transition into that. But what's interesting is, I've done a, and I'm no doctor or anything like that. So all of this is just me curious about my own self and researching about my own self and how I can improve this. Of course, all gut health or most gut health revolves around probiotics and prebiotics primarily. Probiotics, you talk about things like probiotic rich foods, can't do it. Probiotics in general, most probiotic strands. Now, there are some probiotic strands that are not as histamine prevalent, I guess, or they don't cause histamine in the body. So I can tolerate those, but it doesn't seem to be able to help. So the irony in my situation is that a lot of the gut health things that are recommended in this situation, they actually reverse a lot of, not reverse, but they also actually cause more issues than help. So, and that's just the trickiness of intolerance in general, I think. So,
and everybody being different. Yeah.
Yes.
It's not never a one size fits all for everybody. Yeah.
Yes, most definitely. However, I do want to hit on the point of the reason why a lot of people skip the step that we're talking about, meaning eliminating things and then adding them back in, is because it takes time and it takes patience. However, if there's something or a number of foods that are causing a handful of issues that you're dealing with, and you can just eliminate these foods and test it over a couple month period of time, and everything improves, I think it's worth it. So I think it's worth hitting on that point that yes, it takes time. Yes, it's something that is not an immediate pill, something that you can just take and suddenly things feel better. But you can actually start to heal your body over time if you do this.
And then you've really done your due diligence to get at why you have the current stuff. But now you put yourself in a good position not to keep getting new stuff as time goes on. This is really the best in preventative medicine as well. Because if you got health issues, you want to get rid of them. But because you actually went after the root cause, well, now you're in a good position never to end up getting cancer and autoimmune disease and Parkinson's, Alzheimer's, dementia, heart attack, stroke, all those kind of things. You go, geez, I wouldn't wish that on my worst enemy. Well, you've done a great job of getting at the root cause. This is where you kind of mentioned, I'll just take a pill for the symptom, but you didn't fix the root cause. Well, that root cause is going to keep pushing you in the wrong direction. You just keep getting new stuff on top of the old stuff. until you actually go back and get at that root cause.
That's good. All right, we got a little bit more time, 5 minutes, 10 minutes or so. So the gut-brain connection, you hit on it a little bit, brain fog, focus, anxiety, depression, all these different levels of gut or head problems, if you will, brain problems. And it's hard to appreciate that your gut, something that is lower than your head, can have such a significant impact on what's going on up here. So, how do you start to circle that square? That what is going on with your head could potentially be, and there's a very high likelihood that it's starting with what's going on down here.
Yeah, so as the human body develops during pregnancy, the fetus, the gut, the nervous system of the gut, called the enteric nervous system, the immune system that surrounds the gut, all forms before the brain. And so it's the enteric nervous system, the gut, the immune system of the gut-associated lymphoid tissue, that drives brain development. So that if all that's healthy, we get healthy brain development. So truly, the gut probably is the first brain, not the second brain, right? And so it gets development. And you go, well, that is so cool. Well, then you got to keep this healthy gut through brain development, 1 year of age, 10, 12, 20, 30, all this kind of stuff.
Yeah, I heard you use papaya, maybe was your acronym for that. Prenatal,
And
yes.
Yeah, prenatal, before conception, antenatal during pregnancy, pediatric, young adolescents, and young adults. And every step along this way, you can do some great stuff for either reversing disease or preventing it. Kind of the sooner you do it, the more bang for a little tiny bit of effort you get. There's a really important thing the liver has to make. Historically, it's been called the bile acid, but now it's called the chaperone molecule. And it's called TUDCA, capital T, capital U, capital C, capital D, capital A. And bile acids are important for the gut, digesting fats, all this kind of stuff. But TUDCA turns out to be a really big connection between gut and brain. So in the gut tissue, there's receptors for things the gut needs to help itself. So like vitamin D receptors. So vitamin D can attach, tell the gut cells what you want to do. Very important. Well, there's receptors for TUDCA in the gut, also the kidney, the liver, all this. So it can attach and tell the gut what to do. But those exact same receptors are in the brain. And we go, oh my gosh, this TUDCA, not only does it keep the gut healthy, but it's the exact same thing the brain needs to stay healthy as well. And that's a big connection between what happens between the gut and all this. And so this TUDCA is really fascinating. So our world is very challenging to stay healthy. And whether it's environmental toxins, excessive stress, the foods we eat with the additives and all this. So the human body, if you take away the water, we're 80% protein. Got some vitamins, got some minerals, got some fat, mineral, protein. So hormones are proteins, neurotransmitters are proteins, all this kind of stuff. So our world, though, creates inflammation in our cells right in the spot where proteins are made, called the endoplasmic reticulum. And this endoplasmic reticulum stress, inflammation, causes misfolding of the proteins when they're being produced. This misfolding of proteins is the supercentral mechanism for all the things they call the civilization diseases, all these things that we're seeing so much more now than we used to. So things like cancer, heart attacks and strokes. Geez, guys are having heart attacks in their 20s and 30s. It's crazy. Chronic kidney disease, obesity, diabetes, autism, high blood pressure, cholesterol, cataracts, retinal disease. It's so important for neuroinflammation control. Here we got young people with every kind of brain thing you can imagine. Oh my gosh, ADD, ADHD, depression, anxiety, panic attacks. But then also we got the neurodegenerative diseases like Parkinson's, Alzheimer's, dementia, Lou Gehrig's disease. Well, they call this TUDCA the chaperone molecule because it chaperones proteins through the production process so they do not get misfolded. Including, this is a central mechanism of type 1 diabetes, which is a kid's diabetes, except for the fact that now adults' pancreas can't make insulin either, which we're like, well, that's a kid's disease. Well, you need this TUDCA from the liver to get the pancreas to make insulin. Insulin's a protein. So this is where premature infants' livers don't make as much TUDCA as term babies' livers. So preemies are more likely to get type 1 diabetes. But that is such an important thing, this TUDCA, that it sets the system in such a bad place early on that premature infant is more likely to get type 2 diabetes like in their 40s. It sets us in terrible. So this is a huge thing either to make or to take as a supplement as a young person. If you got these things, we go, oh, this would happen to you during your birth process, right after you got a NICU, you got jaundice, whatever. But it's such a central mechanism, everything. But it's a big connection between why the gut and the brain sort of need the same stuff. If the body parts can make it to keep both happy at the same time, you're in a really good place. If that doesn't happen, it's nice that we have options where we can actually give the brain and the gut what it needs, and they both go, oh, I'm so happy now. This is awesome. Are you happy? I'm happy. Good. Both gut and brain are happy at the same time, and then you're in a good place not to get health issues as time goes on.
It is so fascinating to me, and that's incredible that something so simple, the chaperone molecule, is that what you called it?
Yeah,
That's incredible.
Fascinating stuff.
That's
so
incredible.
Cool.
That is so incredible. A lot to process there.
The brain is fast. The body's fascinating, isn't it? Oh my gosh, we learn just so much every day.
It really is. And I think, these kind of conversations are very important for the general population, because not because you need to be a scientist or because you're trying to be a doctor or anything like that, but to understand the mechanism behind what's going on with your body, behind what's actually happening, instead of just being served up a menu of pills, instead of just being nudged along this path of, here, let's just keep covering some things up and keep pushing it to the side. Let's actually, like you said, get to the underlying root cause so that we can build you from the bottom up and actually build you into a resilient human.
Yeah. And then what life throws at you, your body, it goes, I got you covered. Wish that on my worst enemy, but I got you covered. I'm going to keep you healthy. And you're like, all right, body, good job.
That's
good
so
job.
Good. David, I appreciate your time so much. Maybe we can jump on again. I think we could just keep going down rabbit holes forever. But I appreciate your time. Where can people find you to get more information?
Well, thank you. It's been my pleasure to be here, Jerry. Yeah, people can get me at drdavidbilstrom.com. And we have 2 different levels of courses for non-medical people, 2 different levels of courses for medical people. We want to teach every medical person this information. So there's somebody in every community that knows how to do this. And of course, we post on social media. I have over 100 different videos on my YouTube channel about this stuff, pretty much every one. This is the scientific study from this journal, this date. This is what it says, so people know what the science is. Because if you're, knowledge is power. And if you know stuff, you have the power to really transform your life and get your health back if you need to, or stay healthy long term.
Most definitely. And stay healthy long term, get your health back and stay healthy long term, I believe, are very necessary goals. Very necessary goals.
And if you're not feeling well, one thing that's so important is to know that your body is so good at healing. It's trying to fix what you got. It knows how to fix what you got. Something's gotten in the way. And if you just get it out of the way, the body goes, all right, hot dog, I can fix anything now. You should never feel like you're stuck with something and it's a death sentence or a life sentence.
That's so good. Just get it out of the way. Very nice. David, appreciate you so much, sir.
Thank you, Jerry, for having me.